Bookuna is a booking platform in the Philippines that aims to provide more affordable and accessible vaccination services from quality providers. Bookuna is part of the IDEA Incubation program for early-stage tech startups co-implemented by PhilDev Foundation and the Department of Trade and Industry. Troyss Pilapil is the co-founder and CEO at Bookuna. Mikee Chua is the co-founder and COO at Bookuna. So, hello Troyss. Hello Mikee. I'm so excited to have this conversation to know more about
Hello.
Bookuna.
Hey, hello,
Hi,
Johnny.
Johnny. Hi, everyone.
Yeah, I really want to know more about vaccination and actually yung state ng vaccination dito sa Philippines. I'm not that familiar about this thing. So let's start with the question, ano nga ba ang Bookuna?
So, ang Bookuna ay isang vaccination booking platform where you can access your vaccination needs in an experience that's tailored for you. So, we believe that vaccination shouldn't be intimidating, shouldn't be ignored, and shouldn't be expensive. So, we know that vaccination is preventive care. So, maraming mga tao usually, they don't feel strongly about it. But we know that when you choose to get vaccinated, you are ensuring the protection not only for yourself, but also for other people. So, also, Bookuna is focused on reducing the financial barriers to these services. So we offer more affordable services through our Bookuna Circle initiative, which we can talk about later. But mainly, Bookuna is a platform where you can book your services directly or for convenience or by group for affordability. So as we say, you can book your bakuna at bukuna.org.
Yeah, actually like me, I'm not even literate. I mean, I'm not that much literate about vaccines. Hindi ko nga alam kung anong vaccines ang meron ako. I mean, maybe nung bata ako, diba? And I think not just me, I think many Filipinos are kind of like in that state, no? Pero can we know muna, ano ba ang vaccine? Like maybe we can just get a short definition. Ano ba talaga ang vaccine? Ano ba talaga yung ginagawa niya aside from like offering this preventive care nga?
So, a vaccine is any substance. It's a substance that provides immunity. It can do it by increasing you having an antibody against a certain disease without actually causing the disease. So, pwede siyang inactivated vaccine, pwedeng subunit vaccine. So, it can be yung mga ganung types. So, basically, what it really does is to prevent the onset of these diseases na maging fatal siya sa iyo.
Yeah, and speaking of that, sa Pilipinas, ano ba yung mga usong vaccine? I'm really not that familiar with this. And sa tingin nyo, ano yung mga vaccines na dapat i-take ng mga tao maybe habang bata or maybe habang tumatanda? Like, I think I took hepatitis B vaccine when I went here dito sa Taiwan. I'm in Taiwan right now kasi I think they have that parang regulation for overseas students and workers. And how about in the Philippines?
Yeah. So, actually, yan din yung usual na nagiging tanong ng customers namin. And that's where what we've learned, no, na yun yung mga kailangan talagang i-address natin, that it's not simply about delivering the vaccines na maging accessible sa mga tao, but it's about not really educating, but making the people more, more active about their health. So, dito sa question mo, no, na tungkol sa ano ba yung uso. So, may mga types kasi may flu season na, so kailangan magpa-flu vaccine ka. But in terms of ano ba talaga yung mga kailangan nating makuha? So for 0 to 5-year-old children, it's mandated by law na yung mga Pilipino mabigyan ng certain vaccines, which is for example, mga BCG, hepatitis B, mga ganung bagay na libre sa health centers. So mga pediatric vaccines to, ang dapat kinukuha ng 0 to 5-year-old children. For adults, meron tayong pneumococcal vaccine, which is a PPSB23 ang pangalan. So, pasensya na, medyo ganun, no? So, tapos syempre, flu vaccine every year. And for men and women, by the way, HPV vaccines. So, may misconception na dapat babae lang. Actually, hindi. And syempre, napapanahon ngayon na yung mga hindi pa nagtitik ng COVID-19 vaccine ay kunin na rin.
Yeah, I think very timely yung issue ng vaccination, no? Especially with the COVID-19 pandemic. Maybe later we can talk more about that. Pero, I mean, it's surprising. Hindi ko actually alam na mandated pala by law, like some of these vaccines na required pala sila to be taken by children. Pero yun nga, ano nga yung problem exactly? I mean, I'm just wondering also, like, bakit nga hindi tayo, or ako rin, bakit hindi tayo ganun ka-literate or familiar sa vaccines? Maybe kulang ba sa education or sa information? Kulang ba sa access? Mahal ba? I mean, what's the problem ba na na-pinpoint nyo maybe?
Actually, lahat ng sinabi mo ay part of the problem, no? I think it's an interplay of all of those factors. So first, with accessibility, as what Troyss said, there are mandatory vaccines na available in local health centers. So yun yung usually for 0 to 5-year-old children, meron talaga dapat na bakuna for them. But in terms of accessibility, not all types of vaccines that you need are available in local health centers. So that's what we actually found out when we started our first startup, which is called CareGo EMR. So that deals with working with rural health units, no? So with barangay health workers and midwives to help them streamline the vaccination processes. So yun yung nalaman namin. Actually, yung Bookuna, it's parang it was or it happened because of our learnings from CareGo, no, with working communities. So ayun, so since not all vaccines are available in the local health centers, and some of them are available naman sa private centers. So parang yun yung gap na gustong i-fill ni Bookuna to provide these services like HPV vaccines, no, which is very important, by the way. HPV is actually one of the viruses that causes cervical cancer. So it's one of the leading causes of death among women. So if we can prevent it, diba, why not take the precaution? So ayun. And also it's a factor of cost. Kasi nga, since yung mga bakuna naman sa health centers, they are for free. But yung mga sa private clinics, they are usually expensive. So to give you an example, yung HPV vaccine, one dose of it costs around 9,000 to 10,000 pesos. So if you're a young working professional, and usually yun yung recommended age to take that vaccine. So if you're young working professional, syempre you have needs, diba? So parang ang mahal niya for that type of person to acquire, to parang avail. So that's also one of the factors. And lastly, as you said nga din, education din. So parang, I remember now, we were mapping yung customer persona journey ng mga target namin na users. And we learned na merong iba't ibang klase ng tao. Merong mga totally parang hindi sila aware kung ano yung bakuna. Meron naman aware sila pero hindi nila nakikita yung importance ng bakuna. Merong alam nilang kailangan nila magpabakuna pero parang wala lang urgency na magpabakuna ngayon. So may mga ganun, no? So parang I think it will be parang addressed by education, then raising awareness which vaccines to take para ma-generate yung intent to actually avail of that service. And also yung hesitancy during the COVID pandemic, di ba, sobrang daming hesitant to take the vaccines. So maraming factors like cultural, may religious din, and some misinformation, sadly. So may mga fear-based beliefs na nagfo-form around it. So ayun, I think it's caused by a lot of factors. And to add to that, siguro partly because it's mandated by the government, yung implementation din ng mga required vaccines. It should be effective and timely para hindi nagkakaroon ng missed opportunities yung mga bata. So for Bookuna, what we do is we cover what's not offered by the government. So we focus on these services.
Yeah, and actually I saw sa inyong website, no, I mean, you mentioned those, yung parang classification ng mga target users. Meron din actually, I saw this in your website, na you also do this in order for the whole community to achieve herd immunity. Kasi parang minsan, we think that vaccines are only for us, pero we don't know that vaccines are also for the society. So meron din atang ganong aspect. And then I want to ask, diba, so Bookuna is mainly I think a booking platform. And I also saw yung Bookuna circle. So can we know exactly how do you address these problems nga in cost, in accessibility, in education?
So, sobrang daming problema, no? So, we try our best to help solve the problem. So, first, we offer two services actually. So, the first one is direct appointments. So, when you book through direct appointments, we have this online platform of vaccination services from our partner clinics. So, usually, ito yung mga neighborhood clinics, yung mga solo doctors, para easily accessible siya sa mga tao. And second, with Bookuna Circle, that's the second service, no? What we help solve with that is the cost. So we try to parang group the people who want to be vaccinated in a certain type of vaccine and offer them at a more affordable price. So may mga tao kasi na yun naman yung pain point, 'di ba? Actually ginagawa na rin siya ng mga doktor. Kunyari kapag meron kang kapatid, papa-flu din siya, usually nagbibigay ng discount, 'di ba? So we just want to streamline that process na parang syempre it's added effort then and time to the doctor and mahirap for the patient to look for other people. So we do that for you, and at the same time we reduce the cost. And in terms of education naman, we do our best, no? We create campaigns to raise awareness on what vaccines are and why they should take vaccines. So it's a long way to go, but we're trying our best to help solve the problem.
Yeah, okay. So I think I think parang ang daming gustong gawin ni Bookuna. I think it's trying to offer like not just a booking platform pero overall approach dito sa problem ng vaccination, accessibility and illiteracy maybe and yung cost nga sa Pilipinas. Pero in this time of COVID-19, I mean, do you also aid our current clinics and facilities for providing COVID-19 vaccinations?
Right. So regarding doon, I think in terms of operations, wala pa naman kami. But I think it can be best answered by our COO.
Okay, so right now, no, not yet, because we're partnering with private clinics. So once the COVID vaccines are available na sa private clinics, then if they offer it, then we're gonna offer it also in the platform. So
yeah. So parang so you focus rin now sa private providers, is that right? Tama ba?
Yes.
Okay. Actually, I mean, I'm not that sure din sa dynamics kasi ng vaccination, services. Kasi meron mga government providers, mga public sector providers, and then meron mga private institutions. Yeah, so another thing na for me is very important to ask, and I want to know your opinions. Kasi I think in the Philippines, for example, merong new disease or merong new something na kailangan ng vaccination. Sometimes, yung mga ibang underprivileged countries and maybe sometimes the Philippines, nahuhuli yung pagkakaroon ng vaccine. Do you have a take on this issue? Totoo ba na unfair ang distribution ng vaccines? What can you say about this?
Go Mikee. Actually, medyo mahirap siyang dynamics na sagutin. Pero go Mikee, say ikaw muna.
Okay. So, first of all, with the COVID vaccines, sobrang bilis niya nagawa, to be fair, no?
Okay.
As in previous vaccines, it would take decades kasi kailangan ng clinical trials. So because nagkaroon ng emergency, sobrang urgent niya, sobrang bilis din ng paggawa ng vaccines. And I think it's also because the scientists and researchers around the world have been studying the SARS coronavirus before. So naging mas mabilis for us to design effective vaccines against COVID. So with regard to what you said naman, na parang hindi equal yung pag-distribute ng vaccines, I think it's a big problem, no? It's involving big countries, governments. But I think I remember what yung WHO said na the problem nga with vaccine inequity is that the virus travels faster than vaccines are being distributed. So it's a big problem because yung protective impact of vaccination, it relies heavily on the percentage of people that are vaccinated. So if you have more vaccines, it doesn't mean that you become more protected or you become stronger kasi you only need 1-2 doses and say a booster shot as recommended, di ba? And I think yung pinaka-important is that vaccination only works in the context of herd immunity. So, kailangan talaga maabot yung mga hindi naaabot. So, but in the context of Bookuna, di ba? What we can help with right now is just focus on making already available vaccines more accessible and more affordable to those who need them. So we're just trying to work on where we can have the most impact. But yeah, definitely it's a big problem.
Yeah, do you have something to add there, Troyss?
Yeah, actually, so siguro para lang siguro share lang namin saan ba kami nanggagaling, bakit ba kami ganito yung reactions namin. Kasi we've been working for the DOH before. So, we worked before under a government research institute. So, siguro one thing na pinaka-important and something laudable for our government is building these institutions. I'm not sure if anyone's familiar with the new institute that we're building. Ay, hindi kami kasama. I mean, yung ginagawa ng gobyerno under the UST. Na mag-address sa mga ganitong types of concerns. Kasi I think it's time na for our country to create something of our own. Kasi I believe na sa mga kung sa human capabilities lang na kaya ba ng mga siyentista ng Pilipinas gumawa ng sarili, I do not think na hindi. Kailangan lang ng suporta. So, saan ba nagsisimula yun, di ba? I mean, kayang-kaya talaga. For example, ikaw, tayong lahat, no? Kung kaya naman natin lahat na, alam mo yun, kung kaya gawin yan ng mga Pilipino sa ibang bansa, ba't hindi natin kaya dito gawin? Kaya rin natin yun. And I believe sa Filipino talents, hindi talaga papahuli. So, laudable na step siya towards that, na gumagawa tayo ng paraan na hindi lang tayo maging reliant na sa ibang bansa in terms of making this. And sana dumating, I hope, kahit within my lifetime, that we can create something of our own.
Yeah, it's true. I really agree, na dapat nga actually, sana we really have that. Actually, we have the talent, the resources maybe kailangan pang dagdagan. Pero kasi ang problem, if we cannot make our own vaccines, malulugi rin tayo sa cost. So malulugi tayo sa access, 'di ba? And in the end sa distribution. And I really like yung sinabi ni Mikee na parang we really need to really give out, to really put out the vaccines out there kasi it also helps talaga the whole society. I mean, in terms of herd immunity nga, 'di ba? So parang Bookuna is also a mission Is that right?
Yeah, syempre, we believe na talaga yung vaccination, it's a social responsibility. It should be a community effort. Kasi you are only safe when everyone else is safe. So, yun. I think it really aligns with what we're talking about as a team internally, So, yeah.
Yeah. So, can we know naman about your backgrounds? I'm really interested dito kasi why do you have this mission? Saan nanggagaling yung parang puso nyo to really do this vaccination mission? So, maybe can I ask Troyss and then Mikee, ano ba yung background nyo and why did you choose to build this startup?
Yeah. So, ako, I think, sa napagkwentuhan na kanina, na we worked before as a vaccine researcher sa vaccine development project siya. So we were researchers under that project na for vaccine siya. So I worked before for flu vaccine development and it was actually an idea of a great Filipino scientist, sila Dr. Padlan. And nag-name drop na ako kasi magaling talaga siyang tao.
Of course.
Idol talaga. Magaling siya. So, and through the guidance nila Dr. Ibana, Dr. Mario Yiz, and Dr. Gisela, through them, I've learned na itong mga bagay na to, doable pala talaga sa Pilipinas. And I can't believe may ganito palang gumagawa sa Pilipinas. No? So, kung doon una kong naisip na, important pala to. kaya pala talaga siyang gawin. And hindi pala kailangan na, alam mo yun, na, kasi sanay tayo na nakikita natin yung mga bakuna, galing pang ibang bansa, mga ganun.
Yeah.
Pero naisip ko, kaya pala to. So kung kaya gawin to sa lab, ba't hindi natin parang, ano ba? So yung una ko naisip is, so parang medyo maaga kasi ako, simula bata pa lang na, naniniwala talaga ako science and technology talaga ang pag-asa ng bayan. Kasi yun talagang paniniwala ko, bata pa lang ako. And there's no other way para maging developed country ka without you harnessing science and technology. So kaya ako nag-startup. So dun nangyari yon.
Okay.
Pero before everything nun, lahat puro science background ako, puro technical, no? It's about the lab, it's about creating these vaccines and learning from my mentors. And while also doing that, I was also a MS microbiology student until now. Actually, I'm finishing it. And yun nga, natuto ako sa top scientist na mentors ko. And yun, naging part ako ng vaccine projects nila. Kaya naging mulat talaga ako, no? Lalo na, syempre sa gobyerno tayo. Namulat ka talaga na, ay, ganito pala. So, ayun, that's for my backstory.
How about Mikey?
Yeah, so same, no? I'm also a vaccine researcher. I've been involved in a malaria vaccine development project. Actually, colleagues kami ni Troyss. So, we both know how each other work. Kaya parang naging push din siya for us to start this. So ayun, my background is molecular biology and biotechnology from UP Dalaman. Tapos mostly lab work talaga yung skills ko. Very technical skills. No business background whatsoever. Kami both. And at the same time, none of us are developers. So, we're both, puro puso lang talaga. Doon nagsimula, no? So, I can still remember kasi, if I may, no, yung backstory kung bakit nagsimula yung, parang puso namin to create something through a startup. So, in December 2019, actually, there was this polio outbreak. So, polio kasi, it was already eradicated for almost 20 years in the...
I remember, yeah.
So, dapat wala na, di ba? Kasi may bakuna for that and na-implement naman dapat. So, with that, no, parang we talked and then both of us are vaccine researchers and then we're seeing the children getting affected, getting permanently disabled. So, parang there's this disconnect with what we're doing in the lab and what's happening on the ground, diba? So parang sabi namin, okay, sige, we joined the hackathon. So we started actually hackathon at Make Sense. So ayan, from there we started Cargo EMR, yun yung working with the government units. And then we built solutions, ayun, talking to customers. Sobrang iba niya sa kung ano yung nakasanayan natin sa lab. But at the same time, it's exciting kasi you're building something new. And it's not only for yourself. It's for the people, Filipino people. And, you know, as, parang yun din talaga yung shared mission namin ni Troyss. That's why, ayun, Bookuna happened.
Yeah, it's true, no? Yung sa polio, actually, naalala ko nga, na parang may problem nga. I mean, maybe kasi yung vaccination, parang may two aspects yan eh. So, both of you nga are from like the academic or the research part ng science and technology. You can develop effective vaccines, pero at the end of the day, kailangan pa nung parang distribution part, maybe logistics, and then yung what do you do nga now, yung accessibility, booking, I mean, giving it out there. So, maybe may gap doon sa part nga ng distribution part. So that's why you went from the research into this startup. So, and speaking of your backgrounds, you mentioned nga na both of you parang walang previous background sa business and then sa development sa programming maybe. So is that the reason why you joined Idea Incubation Program by PhilDev and DTI?
Yeah, actually, that's one of the reasons. Kasi naghahanap talaga kami ng makakasama. But we're fortunate to have met Mr. Rian Luces. He's a very good developer na dun, through his leadership sa aming mga nagawa sa website namin, yung mga ganun, na-push talaga, no, na napadali yung mga kailangan developments for Bookuna. Kasi I remember we started Bookuna actually until now, no, yung ibang bookings namin naka Google form pa rin, di ba, Mikey? So, as in, ganun ka, ano talaga, as in, ano talaga, MVP kung MVP. Pero, ang nagmamatter kasi at the end of the day, isa na sa natutunan namin talaga from doing this startup, what matters most is, can you deliver the service?
Yeah.
And we did. So, kung na-deliver, no questions asked. Ituloy-tuloy mo lang and do it better. So, kaya sobrang laking tulong yung PhilDev kasi it gave us structure. How we can do it better. Kasi, masakit man sabihin, no? Hindi enough yung puso lang. Kailangan mong gawin. Kailangan talaga. Kailangan may structure. Hindi pwedeng puro puso. Kailangan mong pag-isipan. Paano ba magaganap yan? What are the concrete milestones that you have to reach to actually see the success of Bookuna, to actually accomplish your vision? Diba? So, yun yung mga bagay na sa unang masasaktan ka talaga. Parang, hindi pa ba enough na nag-care kami? Diba? As in, mapatanong ka eh. Hindi pa ba enough yun? But actually, it doesn't. It's not enough. If you really want to deliver the impact, you need to have the structure. And we're very happy to be accepted in this incubation program sa PhilDev Idea program. Kasi, ang dami namin natutunan. As in, countless. Yung learning experience, grabe. As in, for one, no, na-mention nga, na structure namin yung company. And especially B2C to. So, sobrang bago sa amin kasi nung una namin ginawa yung CareGo, it's B2G eh. So, it's for the government. So, ang dami namin hindi na-cover nung ngayong panahon. But siguro, yun, parang kung summary, yun yung pinaka talaga. As in, sobrang pasalamat talaga sa PhilDev.
Yeah, I actually interviewed Sasa kanina. The project manager of Idea Incubation Program. And it's true na they said na they accept startups na mayroon ng product market fit. Kumbaga, like in Bookuna, maybe you have your MVP already and naka-deliver na kayo ng service sa ilang customers. But if you really want to scale like sa buong Pilipinas, really to bring this service sa lahat ng isla ng Pilipinas, it's true na you really have to like operationalize and like to have the structure para maging tuloy-tuloy siya, maging sustainable yung process. So, do you have anything to add there, Mikee? Also, maybe like ano kaya yung parang mga pinaka nakuha yung benefits really from this program?
For one, it's for free. So, learning from people who have done it already and having this community of founders and having it for free. I mean, may free pa ba ngayon, diba? So, yun yung parang pinaka-perk, no? And I think yung mapipinpoint ko na sa tingin ko nag-help talaga sa amin is the mentorship sessions, yung one-on-one. So, very helpful session siya with our mentor, si Miss Gita Gopalan. So, we were having mentorship sessions and it helped bring new perspectives and approaches kung paano namin i-run yung startup. And what I like about Gita is she's very straightforward with us. So parang yun yung parang tough love na alam mo yun, parang kasi with us, no, very kaming team lang yung nag-uusap. So syempre, kung ano yung nakikita namin, it's the same thing. Pero with a person who's already done these things, tapos nakikita niya from the outside in, sobrang laki ng perspective na naibigay na sa amin. So, ayun nga, no, parang sabi nga ni Troyss, hindi enough yung puso. Kailangan pag-isipan din natin to. So, parang lagi niya sinasabi na it takes more than goodwill to create impact. So, ayun. I think that's one of the most helpful things that the idea incubation program has done for Bookuna.
Yeah, speaking of this structure and this like yung pag-operationalize nyo ng Bookuna, I just want to know before I ask you like ano ba yung long-term plans nyo? Like where is Bookuna now? Like ano na yung state ng Bookuna now as a booking platform? I mean, can you just share? And maybe our listeners may want to book vaccination services. So, I mean, what really can they see and can they really get from Bookuna now?
So for Bookuna, we're still early stage. We're not claiming we're already so big. We have this grand vision, but of course, you have to start from somewhere. So we have bookings already. So we would very love to receive bookings from anyone, no, na gusto mag-book, and we'd be very, very happy to share with you kung naghahanap ka, kunwari, hindi mo alam kung anong bakuna ba yung dapat para sa'yo. Send us an email, like, sagutin nyo lang yung Google Forms namin. I personally, I'd be very happy to help you learn more about the vaccines that you need.
Amazing.
Kasi that's our vision eh.
Yeah.
Diba? So, yun. If you want to book sa Bookuna, you can just go on our website or send us a message to our Facebook page.
Yeah, do you have something to add, Mikee? Yeah.
Yeah, and also we're running this, yung Bookuna Circle initiative nga namin. We're offering discounted vaccination services for HPV. So we partnered with a community, with Sinaya Tribe. So we have open slots for Bookuna Circle. So you can receive up to 10, 20, 30% discount. It depends on how many people are gonna get in the Bookuna Circle. So feel free to ask us about it.
Yeah, I think I mean, one of the things no na pinakakailangan ko as someone who's not really familiar about vaccines. I like yung sinabi ni Troyss na parang just send an email or parang I can say what I am. I mean, I can say like ano ginagawa ko, and then maybe my background, a bit of my background, and then you can recommend me or you can say to me, ano ba yung vaccines na kailangan ko i-take? I mean, that's the first step, and then the next step is booking na madali gawin, and maybe you can make more cheaper nga and more accessible. Parang I go to this clinic or something. So parang somehow end-to-end siya na service. Is that right?
Yeah. So actually, we're very happy that currently we're on the stage of developing this feature sa website namin where you can learn all about the vaccines. Through the help of Mr. Adrian Dasigor, Science Communication Lead. Mako-complete na namin siya. Abangan nyo around this May, no? We will release it. Para actually it's for everyone para malaman nyo ano ba yung brand ng vaccines na to, ano ba yung age na kailangan, para syempre kung nahihiya ka naman mag-email, you can also read it there, di ba?
Yeah.
So ayun lang.
Yeah, so ano naman yung vision niyo ba talaga for Bookuna, and not just for Bookuna, for the Philippines, for the state of vaccination in the Philippines? Like what do you imagine, like maybe in 5 or 10 years, ano na yung nakikita niyo parang reaction and maybe knowledge ng mga tao about vaccines?
For our vision, it's the same with Cargo EMR. So Bookuna and Cargo EMR is under CPAT Innovation Inc. That's our registered name talaga sa as a company. And under CPAT Innovations Inc., the vision of that company is to increase the vaccination rates of the Philippines to at least 95%. So we really want to achieve herd immunity para sa Pilipino. So alam ko masyado siyang mataas. I mean, sabi pa nga sa amin, good luck daw. And good luck talaga sa amin, no? But it's okay. Kasi para sa akin, kailangan nating mangarap. YOLO ba? Parang gano'n, di ba? You only live once, todo mo na.
It's a shoot for the stars. If hindi nyo man reach 95%, maybe 90%. That's not bad.
Yeah.
That's not bad kasi how many lives are saved with that 5%, diba?
Yeah. And before we end, I really have to ask this question kasi napakalaking problema ngayon. I really want to know your opinions about this anti-vaxxers. I mean, what can you say about this? Hindi lang siya people or hindi lang siya group of people. Parang it's a thought. It's a parang cloud nga. It's a parang lumalaking thought, something. So, can you just share your insights about this?
Well, yeah, we've encountered people na against vaccines, no, with what we post online. Syempre, may mga vaccination campaigns kami. So, siguro, learning lang, no? Anti-vaxxers are anti-vaxxers because they have different beliefs about vaccines as a concept. Sometimes you can address it by stating facts. Sometimes. But mostly, from what we experienced, it's mostly based on emotions, fear, and strong beliefs na hindi yan, mali yan, di ba? And we believe na it's mostly stemming from distrust, parang no confidence in, say, government, pharmaceutical companies, health departments who make and distribute them. So it goes to show that we have a long way to go to achieve protection for all, at least in the case of COVID-19. And actually, we joined community groups ng mga anti-vaxxers. Kasi kami matutunan, diba?
I like that. Yeah.
sobrang, alam mo yun, parang sa amin, sa circle namin, parang out of this world, diba? Parang, bakit? Pero, doon mo ma-realize na pag nakikita mo yung mga sinusulat nila, gusto lang talaga nila yung safest, yung best for themselves and for other people. So, sobrang parang complicated thing to tackle siya. No? Pero, ayun nga, we still have a long way to go with in terms of anti-vaxxers.
Yeah, it's true. Kasi parang, I mean, lalo na yung parang, hindi siya dapat clash ng perspectives eh. Pero parang, i-synthesize natin yung different perspectives. Kasi, I mean, it's true na I think they really just want na safe for them. I mean, what's safe for them really? Parang sometimes they don't want to try new things kasi maybe these new things can harm them. I mean, and we really just need to have a mutual understanding as one whole society. Do you have something to add there, Troyss? And maybe like, so that we end on a positive note naman, no? Parang, what do you want to do moving forward?
Yeah, so for me, medyo mahirap siya itakal kasi emotional thing siya. Bago mo masabi sa kanila kung bakit dapat hindi yun ano. And may nabasa kasi ako sa isang article, parang sinabi ng vaccines are a victim of their own success. So parang because it's too effective, di na maalala ng mga tao yung panahon na wala pang bakuna.
Interesting.
And I'm not saying naabutan ko. Baka may magsabi na naman sa akin, no? Naabutan mo ba yun? Siyempre hindi. Di ba? So, pero I'm just saying, no? If gusto mo talaga malaman kung ano yung totoo, isipin natin siya on the other way around. As much as kung paano rin namin inisip na kailangan namin sumali sa anti-vaxxer groups to actually see those things. I actually had disagreements I actually had talks, no? Na sa mga members nun. They kept sending me links, no? And I also watched. So, para matuto talaga ako, ano ba talaga? Pero, going back, dun ko matutunan, hindi talaga eh. And I replied with as calm as much as possible, no? Para malaman na if ang gusto lang natin, ang common ground natin is taking care about ourselves. Doon rin dapat tayo manggaling sa pag-i-explain sa kanila. It's not about me taking care of you. It's actually me taking care about myself, and I just want to share it to you. So parang ganun yung perspective na tinatry natin i-offer.
Yeah. That's really interesting. And that's a big question maybe. And until now, I think it's still really a big question. So I quite agree na maybe it's still really a long way to go. So medyo ano yung ending natin, ano? Medyo not so positive. But maybe if listeners want to get some booking services or they just want to know more about Bookuna, or maybe ayun nga they want to know more about vaccines kasi they also have this parang some distrust nga ayun. So how can they know more about Bookuna and how can they know more about vaccination? So where can they get more information?
Yeah, so you can visit our website at bookuna.org or our Facebook page, facebook.com/Bookuna. Or if you want to ask questions, you can email us at bookuna.org@gmail.com, or you can add us on our LinkedIn. I think we'll be pretty pleased to answer some of your questions. But we're not claiming to be vaccine experts. All of these are fact checked, so we always put the references. So it's all out there. You just have to see it for yourself. So yeah.
Yeah, I really like yung sort of ender kanina ni Troyss, no? So Troyss, can you put a period on this conversation? So what are your maybe last message lang or invite our listeners to know more about vaccines and Bookuna?
Yeah, so I invite everyone to take part in protecting the Philippines from vaccine preventable diseases. Kasi it's only together that we can win against those diseases. So I think I'd like to end lang na lahat tayo may magagawa. Ayun lang. Maraming salamat.
Amazing. So maraming salamat, Mikee. Maraming salamat, Troyss. This is a wonderful conversation. It's really insightful and it's really parang we're still trying to solve this problem. So thank you for sharing your thoughts and thank you for sharing about Bookuna.
Right. Thank you. Thanks, everyone.
Thank you very much to our 14 patrons. This episode is super powered by NutriCoach, the all-in-one productivity tool for dietitians and nutritionists looking for buy and sell online with Sigurado sellers, and Benjoy's Food Products, the home of premium bacon ends, tapa, and tocino. This episode is powered by ePlayment and Interleukin. Support us at www.patreon.com/startuppodcastph.